Do you feel like threads actually make it harder for you to do a facelift later, or are we helping? Because that's one of the hot topics on social media that is giving that negative light. What's your take on working with plastic surgeons?
I've worked with plastic surgeons for 24 years and they love it because they get a lot of consults and patients just aren't ready for a facelift. They go through the process and they think that they're ready and the neck is throwing them overboard and they're like really want it, but they're just not there yet. They have another 3 years, another 5 years. My plastic surgeon will walk that patient over to me and say, "This is Denise. She does the non surgical lifting and she can lift your face until you're ready for a facelift." So there's a market for that. There's also a market for people that have had a facelift and then it's relaxed a little bit for whatever reason. And over the years, 5 years later, so you could put a couple threads in and lift them back to where they were when they had a facelift. There is definitely a market for non-surgical lifting. Is it a facelift? No. And I tell people all day long, if you look at some of my before and after pictures, they look pretty darn good, like they could be a facelift. But you actually will see that lifting is significant. And if they're not ready for a facelift yet, this is going to be a better price and we can get you lifted for about a year and a half to 2 years. Most people that I do, because the thread quality is so good that we get lifting for about 2 years. So I don't have to worry about the lifting outside of that. Yes, they may want other areas in those 2 years. I'm not worried about putting my patient the procedures out 2 years and I'm never going to see them. No, they're moving on because they like what they see. So they're going to do more. But there's always going to be a place with plastic surgeons. Through Astor Institute, we teach facial plastic surgeons. Lifting has evolved. Years ago, we used to have contour threads and they were terrible. So every plastic surgeon hears the word threads and they're like, yikes, we don't want to do that. I took more threads out than we put in. For the most part, if they're put in right, you don't have to take them out. These are all dissolvable, they're reabsorbable. So if you get a thread that is even not right and you can't do anything about it, it's going to absorb. We could laser over and it'll go away faster. So there's things that we can do. Patients love that interim in a plastic surgery world. They're not quite ready. I like the idea that I can go get a lifting effect and on the face of the neck and put me out another year and a half. So there's definitely a market for that. The plastic surgeons that I work for endorse the use of threads. It's not taking money out of their pocket. It's helping them to give that niche market that isn't really ready for the facelift yet or the neck lift.
You hit right on the mark here. Do you feel that they are at least not starting from square one when before they got threads, they're starting from a new point?
And they've built a better quality skin. So when you do lift that, I was a case where I used threads up until the day that I was like, okay, listen, I'm going to need a facelift. And
Mhm.
so I told my surgeon, like, I went in for something else and I said, you know what? The facelift is more important right now. I have over 250 threads in my face. And he was like, so that's fine.
Yeah.
And it ended up being that during the facelift, he didn't hit one thread at all, not one. And I had him everywhere from lifting to sitting in my skin in the dermis. They're pulling it at different levels. I joked with him saying, you're going to run into all these threads and you're going to have to take them out. He said, I'm not going to take them out. I'm going to leave them in because this is going to help the healing phase. I ended up with two bruises, one on my face, one on my neck. My healing was second to none. I was back to work in 5 days. I was looking a little pulled, but my healing was over the top. He was like, I don't know what you did in this healing phase. And I'm like, think about it. I had 250 threads all throughout my whole face. Before you started, at least 2 months before, 3 months before he started. It's amazing. Our healing, what we see is the healing phase, which you should, because we're helping the dermis. So in that reticular dermis, you have threads maybe a little deeper in the deeper planes when we're lifting, but they're all building collagen. So that's only going to help you in the healing phase.
You talked about getting a facelift and having better results. Do you feel going into the cost of it and the return on investment, what that looks like because you've gotten so many threads, what that looks like for a patient.
Let me give you some examples. If I do a marionette line, I'm going to be using about 12 threads, right? The cost of that thread is $6 a thread. My cost is $72 for that area, right? And
Mhm.
then I'm charging 750, 850 for that area. So that's just one example. Underneath the eyes, I do everybody in the Tampa Bay area, hottest area, right?
Mhm.
Marionette line takes me 15 minutes. Underneath the eyes takes me 20. I'm putting approximately 12 threads per eye, and my cost is $144. I'm charging the patient $850 in a 20-minute session. So the return on investment for threads, when filler is down, when the market is down, people are like downscaling their procedures. This is a procedure where I may not have much filler this week in my schedule, but I definitely made money on threads,
Yeah.
right? So the return of investment on threads has kept me in the market and kept me making more money than an average injector because my return on investment is so huge. When we put a syringe of filler in, it's 400 approximately, depending on what filler it is. If I'm doing Sculptra, it's $457 per vial, and I'm going to do 2 vials. And it's also going to take me a good half an hour, 45 minutes to do all that product.
Mhm.
So that return on investment for me is just not there. It's my time is valuable as an injector as much as it is our overhead. But for threads, it's a win because it's easy, it's fun, it's quick. I can put an area of smooth and twist threads in a matter of 15 minutes. We give them a little lidocaine, put it in there, and you're done. People are like, wow, this is done already. They were anticipating such a drawn out, long process, and it's very quick. For an injector, it means that I can make that money in a day and put on so many procedures. That's going to take my loss in many other areas. Now you can bring it up and get rewarded with threads. When you're doing threads, you don't want to rush and you want to make sure that you're getting them in there correctly. But for a new injector, it's going to take them maybe half an hour to do one area. That's putting the lidocaine in and then doing the act of the thread. The act of placing the threads, when you know what you're doing, even for a new injector, knows where he or she is going in the skin, that still doesn't take very long. The smooth and twist threads are really easy. The more difficult barb ones take practice. And that practice is going to yield good results because the more practice you have, the better outcomes you're going to get. For the most part, that takes a little bit more skill than placing the smooth and twist threads. Through Astra Institute, I have courses where I start you out and we do just the smooth and the twist threads. And we get the benefits of that. We show all the benefits. We show how easy it is to place those smooth and the twist, what combination to use. So you get that skill level down. Then we start learning how to do the barbs. Then
And you
we
can
do
make
the
your money.
lifting
Yeah.
and it's become successful, right? If you're looking at your portfolio of threads, as an injector, I'm going to be overwhelmed. Oh my gosh, where do I begin? What do I order? How do I do this? The company is good at putting them in packages for beginners. This is what you want to order, but you have to crawl before you can take off running. And so you've got to just practice and do them proficiently and take your time. So it is going to be slower in the beginning, but you get faster the more that you do them. And the ROI is always going to, as a new injector, be smaller. But you know that when you keep practicing, you're going to get quicker and your rewards are going to pay off a lot more.